shining a light on the path to feeling better, looking better, and living better. This is Heart Doc VIP, healthy, integrated, and preventive with Dr. Joel Kahn on Empower Radio. Now, here's America's Healthy Heart Doc, Dr. Joel Kahn.
Well, hello, everybody, and welcome back to Heart Doc VIP, the PCast. It's so short, it's a P in the pod. You've heard that. If you're coming back, if it's your first time, welcome. I usually record this at Green Space Cafe on 9 Mile in Ferndale, or maybe sitting at Green Space and Go on Woodward near 14 Mile in Royal Oak. Haven't yet recorded a podcast at the ATX Food Co. food truck on Barton Springs Road in Austin, Texas, but I'm going to set that as a goal. But today, you are getting the Heart Doc VIP PCast from actually a driver in a van taking me from LaGuardia to Melville, New York. I will be speaking at a major conference called The Real Truth About Health. I'm traveling to give a lecture tonight and another one tomorrow. And the other speakers were so amazing that I didn't want to meet the opportunity, and that would be miss the opportunity, if you want to use language that makes sense, to be with Dr. Esselstyn and some other real superstars. So you'll be seeing all kinds of YouTube short and long videos about the Real Truth About Health conference that's being recorded now. So we're going to do it from here because the PCast that I recorded had a technical difficulty. It exists somewhere in the cloud. If you know where it is, email me, tag me, but we'll find it when I get back because it's on a drive. It's in my office at the Kahn Center for Cardiac Longevity. Speaking of that, we wish Lisa Ostrowski a good vacation, well-deserved. Jennifer Dowd and I will be manning the clinic. We have a very busy week coming up. Very excited about that. It's so gratifying to meet people from all over. A lovely lady from south of Nashville yesterday. Delightful, traveled all the way to get some insight into an issue. And I am quite confident we're going to crack the code and help her as we really strive so hard to take the time to do the analysis, to think outside the box, and sometimes inside the box, because we sometimes need to use traditional therapies to deal with what we deal with. But we welcome you to check it out at www.kahnlongevitycenter.com. It's just a website. If you have any questions, you can always email me, Dr. Kahn, D-R-K-A-H-N, at KahnCenter.com, K-A-H-N Center.com. Try and spell that right, K-A-H-N Center.com. I get so many contacts via my Facebook page, Dr. Joel Kahn, America's Healthy Heart Doc, via Twitter messaging, via Instagram messaging, and I direct everybody, just shoot me an email. I can't give you medical advice on Facebook, and I strive hard not to give medical advice via social media, of course, because I don't know who you are until we have a formal relationship. But shoot me an email. It works great. Okay, that was a bit of a long introduction, but you could have been hearing about men's underwear, some other sponsorships. Everything here is sponsored by my enthusiasm to make sure you have your best life and do not suffer from the number one killer of men and women in America. I did post something interesting on Instagram today. The average lifespan in the United States is 79 years, but the average health span, those years where you're really healthy and not dependent on assistance or advanced medication, surgeries, disability, is only 63 years. The last 16 years of our life are spent dealing with serious medical issues. I also will post another interesting graph that shows the United States by far spends more on healthcare per citizen, over $10,000 a year, than any other country in the world. And we are lagging in lifespan. We have more than 35 countries with a longer lifespan, many with a better health span than we have. It's a big problem, and the answer isn't clear. But for you, good listener to Heart Doc VIP, hosted by EmpowerRadio.com, the answer is lifestyle, lifestyle, lifestyle. Watch what you eat, watch how you sleep, watch whether you smoke or not, and don't. Please take care of your fitness, take care of your stress, meditation, yoga, love, connection, community. Your lifestyle can overcome most genetic disadvantages that perhaps your parents gave you. And I have that conversation with patients every day I'm seeing patients at the Kahn Center for Cardiac Longevity. Your genetics are awesome, and if you lead a healthy lifestyle, you're golden, or your genetics are rotten. But good news, let's go through the lifestyle measures and the other measures that enhance your health. So it's all good. We've been here for a little over 4 minutes. Let's get to it. So the topic of the day we're going to do today is called the 8 pillars of plant diets. The 8 pillars. Why 8? Well, because there are 8, and there used to be 6. When I published my book, The Plant-Based Solution, which was published January 2018, it's available on Amazon in hardback. It's been very well received, endorsed, reviewed, and recommended by many, many health experts as an easy read with great recipes from both the Kahn House, the Green Space Cafe, cache of recipes and such. And shout out to my wonderful wife, Kahn, for putting all that together. When I wrote that book and published it, I did have in the introduction the 6 pillars that support your choice of a plant diet. Look, you got to decide what to eat. Are you going to follow these keto people, these paleo people, these Mediterranean people, these DASH people, these Whole30 people? Because you're going to be bombarded all the time by these messages. Or maybe not, but, let's make some quality decisions. So I laid out 6 reasons you can trust the recommendation to eat mainly or exclusively plant foods, breakfast, lunch, dinner, or maybe just breakfast, dinner. If you're into reducing your calories some, like Dr. Walter Longo and the great book, The Longevity Diet, recommends a very small lunch. So pillar number 1, are you ready? Because we're going to go through 8. Pillar number 1 was the 2015 USDA dietary guidelines. Why? Because if you follow food nutrition, you might not think that our government is very favorable to plant nutrition, because they have serious conflicts with the meat industry, the dairy industry, the egg industry, the boards, the funding. And in fact, the USDA serves 2 roles. One is overseeing those industries and dealing with huge lobbies with huge dollars, but they also are out there to make recommendations for the health of the American public. And when they published the most recent guidelines, 2015, they came out actually in 2016, they recommended 1 of 3 eating styles. Number 1, follow a Mediterranean diet. If you're interested in that, there's many good books by Dr. Walter Willett, the just retired dean of the Harvard School of Public Health. I think it's called Eat, Drink, and Be Merry, all about the Mediterranean diet. You can go to a website called oldwayspt.org. Very strange name. oldwayspt.org. And it's a wonderful website about the Mediterranean diet, except they sold out to the cheese industry because they added cheese as a necessary component of the Mediterranean diet. Shame, shame, shame. It never was. It never should be. A little component maybe, but not the way they demonstrated out. At any rate, that was the first recommendation. The second, they called it the healthy eating pattern. Nobody knows what that is, but it isn't Wendy's, McDonald's, and Hardee's, or even Wahlburgers moving into my hospital. No, no, no. And the third was the vegetarian dietary pattern. And if you read the USDA guidelines, it includes a very strong endorsement of a vegan, a whole food plant-based pattern, perhaps supplemented by vitamin B12, emphasizing whole foods, not junk foods, not prepared and processed grocery store freezer versions. So be careful of the plant foods you eat. So that's the first pillar. Our government says 2 thumbs up. But who trusts the government? So let's move to pillar number 2. The Academy of Nutrition and Dietetics position paper in 2016. This is the largest organization of food and nutrition professionals in the world, over 100,000 people and practitioners. And they came out with a paper in 2016, their position paper on plant diets, and it was 2 thumbs up again. It was whether pre-pregnancy, pregnancy, post-pregnancy, infancy, childhood, adulthood, and the elderly, properly planned, appropriately planned, plant diets can be healthy, nutritious, more than adequate to support health, with reduced rates of complications from chronic diseases in those last 16 years of your life. But don't wait till you're 63 if you're young and that start now. And they again talked about how you can get your iron and your calcium. It's a wonderful paper if you were to look up, and I'll give you the clue where you can find all these references in a minute. Pillar number 2, the largest dietitian group in the world. Pillar number 3, our medical insurance arm of the government called Medicare. You know Medicare, more formally known as CMS.gov. And in 2010, CMS.gov was asked to analyze whether there were any eating patterns that can prevent and reverse heart disease, the number one killer of men and women in America, and specifically to analyze 3 programs that might halt and reverse heart disease. When they came to their decision after analyzing both the medical data, the economic data, the position that they might actually endorse one of these, they picked 2, and indeed there is a formal government ruling to reimburse for learning about 2 of these programs. One is the Dr. Dean Ornish, or the Ornish Intensive Cardiac Rehab, approved and paid for by CMS, Medicare, Medicaid, and now many private insurers like Blue Cross, Aetna, and such. And the other was the Pritikin from the Pritikin Longevity Center, and Mr. Nathan Pritikin was approved. So there is Pritikin Intensive Cardiac Rehab, teaches plant nutrition. There is Ornish Cardiac Rehab, teaches plant nutrition. There are no others. The third was not approved. No others are. So you cannot find a meat, strong diet that is approved by our government, paid for by your insurer after you've had a bypass, a stent, a heart attack, or angina pain. I wish they would pay for these great programs before you had those events, but at the current time, we're grateful for that. In the state of Michigan, we have the awesome St. Joseph Mercy Hospital in Ann Arbor, a very progressive hospital that has the Pritikin Intensive Cardiac Rehab program. I referred a patient this week from suburban Detroit. They're well worth their drive twice a week, 4 hours at a time for about 9 weeks to get the 72 hours of advanced training in. Okay, let's go to Pillar 4. Pillar 4, the U.S. News and World Report. Okay, maybe you question the panel of experts, maybe you don't. They're heads of nutrition at Harvard, at Yale, at Emory, and other locations. There's several dozen of them. And out comes a list every year, the healthiest diets, the healthiest heart diets. That occurred this year about 3 weeks ago. The Mediterranean diet always ranks well. The DASH diet, the diet assessment to stop hypertension, ranks well. But in heart diets, the Ornish diet, again, you heard already, both the government endorses and pays for it, and the U.S. News and World Report recognizes for heart disease that the Ornish plant diet is the cat's meow without any cats. You can use cat's up, but be careful how much salt and sugar is in your cat's up. So the U.S. News and World Report is a strong pillar of foundation for saying when I go choose what food to eat to power my body, power my family, power my business, power my hospital. They don't read the U.S. News and World Report. Apparently, most of them, you can rely that it's been well thought out. What were the 3 least appropriate diets for heart patients, according to U.S. News and World Report? The ketogenic diet, the low-carb, high-fat ketogenic diet, the paleo diet, try and reproduce caveman food, very meat-heavy often, and the Whole30 diet. Such a popular program with no support and no good long-term data. So that's a strong pillar 4. And we are talking here at Heart Doc VIP from the wonderful drive between LaGuardia and Melville, New York for the Real Truth Conference. And thank you for listening. Sponsored by EmpowerRadio.com. All right, pillar number 5, hospital and plant-based diets. This pointed out that the largest HMO, the largest managed care group in the United States, Kaiser Permanente, based in California but now spread all over, very strong in Atlanta and other cities, has endorsed plant nutrition for their system. They have wonderful documents about how to adopt slowly to a plant diet, the benefits of a plant diets for physicians and nurses, plant diets for hospitals, and there are some excellent examples within the Kaiser Permanente program with more than 10 million lives covered in the United States that support. They are a hospital system that gets it. They've put it out there. I'm sure there's still room for improvement. They're not totally plant-based. We also learned just recently that all public hospitals in the city of New York now do Meatless Monday, and that's a great advancement. So we're seeing hospitals finally come on board. Pillar 5. Pillar 6, Oxford University. This is independent of any plant-based group. Oxford University has analyzed the broad swath of data. They looked at 95 studies involving 2 million subjects, dietary studies, and they published data in 2016 that if we would adopt more plant diets across the world, Oxford University said we could save 8 million lives a year, and we could save 50% of greenhouse gases, which are poisoning our atmosphere, and we could see a 24% drop in heart disease, a 33% drop in stroke, a 14% drop in cancer, and a 31% overall drop in death rates during the study period. That's the 8 million calculation out of Oxford. Strong data, important data, not related to direct ties to any food industry, lobbyists and such. Okay, so that's the big 6 I talked about in the plant-based solution. I don't think I mentioned you actually can purchase the plant-based solution. You actually can go to an online bookstore. Maybe it's Amazon.com, Barnes & Nobles. Pick the one you like. Books A Million. Get the book in hardcover. It's unbelievably reduced in price when you buy it at one of these internet sellers. Maybe your local bookstore has it. Even better, support your local company, of course. What are the 2 new pillars? Pillar number 7, brand new, 2019. Listeners here at the PCAST. It is the document called Eat Lancet, E-A-T, Lancet, L-A-N-C-E-T. 37 experts, 16 countries, 2 years, a foundation called the Eat Foundation that said, if we're going to have 10 billion people living on this planet in 2050, not very far away, 30 years away, how we're going to feed them, and what kind of world are we going to live in at the end of the day. And they put together all their heads, and they came up with a conclusion with a beautiful picture of their suggested food plate, which is very plant strong. Their statements were that we need to start changing our diet with a, quote, dramatic shift and a dramatic reduction in consuming unhealthy foods, a dramatic reduction in eating red meat, a doubling of the amount of plant foods we eat as soon as possible, limiting intake of processed red meats, limiting intake of total meats to very small amounts during the week. That was the recommendation of Eat Lancet, being celebrated all over as a combination of health assessment and environmental assessment, which is really what we need to do. We need to talk always in this field about not just what we're going to have on our plate, but how that's going to impact future generations. And how many of you plan to be alive in 30 years? I know I do. And I want a world that's clean and healthy and the air to be breathed. We need to plan for this. There's more factors than just food in pollution of the environment and global warming. But nonetheless, it is a major factor that you can decide on. That's pillar number 7. And finally, we have to talk about here pillar number 8, which is coming up right now. Pillar number 8 is the recent release in 2019 of the Canadian Food Guidelines. Canadian Food Guidelines just came out. First time since 2007. The entire country sat down with their experts, said, what are we going to recommend to the people to eat? They did not focus so much on the environment. They focused on health. They have an absolutely lovely food plate, which is 1/2 fruits and vegetables, 1/4 whole grains, 1/4 healthy proteins, and they demonstrate mainly nuts, seeds, beans, peas, and lentils. And they suggest the drinking of water, not milk, and obviously not energy drinks and sugary drinks. They go on to say that, number 1, healthy eating is more than just the food you eat. It's also your food habits. Eat with people, eat slowly, eat mindfully, cook at home more often unless you can find a healthy restaurant to eat at. Oh, did I say Green Space Cafe, Green Space and Go, and ATX Food Co? I swear that's basically in the Canadian Food Guidelines. They recommended, reading food labels, limiting foods high in sodium, sugar, and saturated fat, and be aware of savvy food marketing that wants you to make decisions, whether it's in the grocery store, the gas station, or in a restaurant. Be mindful. Overall, the conclusion of the Canadian Food Guideline, pillar number 8 of 8 here for your decision on how to feed yourself, how to feed your family, how to feed your business, how to deal with the world growing in population. Their overall recommendation was shift away from dairy, shift away from meats, find joy in plants, and eat lots of beans and lentils. That is directly what they recommended. So hopefully you have been educated to some degree on some of these 8 pillars. I've put them together in a new article that is out on the internet. If you were to go 8 Pillars of Plant Nutrition, Joel Kahn, It's a website called medium.com. I will also have it on my website, drjoelkahn.com, on my Facebook page, Dr. Joel Kahn, America's Healthy Heart Doc, my Twitter at DRJKAHN, and my Instagram, DRJKAHN. So you're going to find it somewhere. And if not, you can email me at drkahn@kahncenter.com, and I can send it to you. So we're going to shut down Heart Doc VIP as I approach beautiful Melville, New York, out in Long Island, as I get ready to lecture with some of these absolutely wonderful people I am excited to see and learn from and upgrade my skills in all aspects of health. Brian Clements from Hippocrates Health Institute, West Palm Beach, always gives incredible talks. And I always take notes and write down new things that I can bring back to the wonderful people that see me and call me at the Kahn Center for Cardiac Longevity. And I like to have some new knowledge when I run into people at my 3 restaurants. It's always good to share the new and exciting. And these 2 new pillars are truly new and exciting. One is a 47-page document. One's a little bit shorter. But they're well worth finding and reading. They're short guides. There's the full paper. And add them into your daily routines in your daily life. So shutting it down there, Heart Doc VIP, the PCast, the podcast. We'll see you next week, hopefully sitting at Green Space Cafe or the Kahn Center Cardiac Longevity. But I'm glad we could bring you this message today, and have a healthy day.